Hello, I'm Dr. Lavender. I'm the dermatologist who will be performing your skin check and mole check today. How are you? Good. So I see the nurse got most of your information, but we are still missing a couple of things. Can I get you a glass of water or anything? Perfect. Okay. What is your current phone number? And your current address? It's the same? Wonderful. And the same insurance? Okay, I'll make a note of that. You've been wanting to change your pharmacy? Well, there is one closer to your home address on MLK. Perfect. I'll set it to that. And since we are doing a mole check today, I did want to ask if you have any family history of skin cancer. Okay. And I do see that you have a couple moles, so when was the last time you had a mole check? Okay. So I do recommend for my patients with moles or freckles to see a dermatologist and get a mole check at least every year. I know that can be hard to fit in the schedule, but it's so important. All right. Any areas of concern? Okay, I do see that there. So I'll take a closer look and then we can talk about treatment options. Have you noticed any moles or freckles that have grown or changed, even if that means they've gotten smaller? Okay. And lastly, any medications? So we're going to go ahead and start the skin exam first. I'm going to sanitize my hands and put some gloves on. While I do that, can you describe your skin type and your skincare routine? If you use any harsh chemicals, get any skin treatments, things like that. Perfect. So you are on tretinoin. Any side effects? It's a wonderful, wonderful treatment, but it does cause dry skin, things like that. A little bit of skin flaking. Okay. Not too bad though. What strength are you on? 0.05%. Okay. And when did this little area of irritation start? Okay. So sometimes our skin reacts in weird ways. It could be that very powerful cream caused a reaction or just irritated the skin. Do you have a history of eczema in high school? Alright, so if I have your permission, I'm just going to get a little closer. Any pain or tenderness? And this spot right here, does it itch or burn when you apply your skincare? Are you wearing any makeup or skincare products right now? Okay, vitamin C, a serum, and a moisturizer. Okay. So the thing about tretinoin is when you apply an active like vitamin C sometimes, that can increase irritation. Tretinoin is so powerful. I usually tell my patients that almost the only skincare that you need. Alright, so I'm going to press a little. Tell me if you feel any pain. Okay. Alright. I'm just going to look at the skin by your ears. Okay, and then this here. Alright. So what I think we're going to do with this spot, well, first we're going to take a closer look. Alright, so let me just look a little closer here. And then kind of look at the areas that are dry. And you said you are combination skin, right? Okay. So what I would recommend until we get to the bottom of this spot of irritation is to avoid putting tretinoin on that area. Perhaps this whole area, and you are avoiding putting it anywhere near your eyes, right? Okay, good. Tretinoin can cause dry eye, permanent dry eye, so you do not want to apply it anywhere in kind of your eye socket area, and you want to wash your hands after you apply it. Okay. It does seem to be working really wonderfully on your skin. Your skin has a nice even texture, and it has that kind of from the inside out glow that tretinoin is so good at giving. Okay. So were you taking it mainly to combat acne or as an anti-aging? Okay. Well, you have very, very little acne or any pimples at all, so it does seem to be working like I said. Okay. I'm just going to look at the dry little patch here. Make sure that's still all what we would expect. Okay. Alright. Okay. So, from how long you've had this spot of irritation in your previous history of eczema, I'm thinking it could be two things. It could be facial eczema, or it could be perioral dermatitis. They look very similar and they're often confused for each other. The treatment for eczema is usually a steroid cream. However, if it is perioral dermatitis, the steroid cream will just make it worse. So what I'm thinking of doing is taking a swab of the area and sending it to the lab to see if it is fungal or bacterial, and then we'll move from there. Sound good? Okay. So it will not hurt. It's just a little scratch off of the area. Very, very gently. No need to apply any local anesthetic or anything like that. It'll just feel like a little scratching sensation. Okay, so let's go ahead and do that. We're going to clean the area first. Alright, and it doesn't look like you have any open spots, so this should not sting. going to take a little scrape off and then also swab it with a sterile swab stick. And then send both of those to the lab. Alright, so just going to scrape and tell me if it at any point feels painful. And then swab, swab, swab. Can you take these to the lab? Yeah, I already put the tests on their file. Okay. Alright, so while those are taken to the lab, I'm thinking that in the meantime, you stop the use of the tretinoin and just focus on healing your skin barrier. I'm going to change gloves. We want to be as gentle as possible with this area. I know it's frustrating to stop tretinoin, but it's worth it to not really aggravate your skin. I also recommend using a cream that has a lot of zinc and copper in it. My personal favorite. This is one by Avene. It's called the Cyclophate Plus. There has been some evidence to support a zinc cream or a zinc face wash in helping perioral dermatitis. So if you do buy this one or a similar cream, you can even buy diaper cream. I know that sounds weird, but it's almost the same thing. And it is incredible for helping with itchiness, redness, things like that. You're going to want to apply this morning and night after gently cleansing your face. I believe you can get this even on Amazon. It is not prescription. Though I can also give you a topical antifungal if you want to take a day or two of that while the lab is processing those results. Unless you see any furthering irritation, it should be pretty harmless. You'll just wait for the results? No, that's totally okay. Alright, so let me change gloves. And then we're going to start the mole check. I am seeing a few, so I'm going to go grab a special pencil to mark on your skin any ones that we want to keep an eye out on. Okay, so let's just get some new gloves on. So since you've had a mole check in the past, you've probably heard of the ABCDE rule. You'd like a refresher, of course. So when we're looking at moles, even on our own bodies, we're looking to see for ABCDE. We're looking for A, asymmetry. So when we want a mole to look like a circle, so when the mole is kind of strangely shaped, that's asymmetry. And then B is border. So we want the border of the mole to be nice and consistent, not have weird edges, things like that. And then C, color. If the color has changed into a very dark color, usually blue or black or red, things like that. Normally moles are a couple shades darker than our skin tone. So we're looking for abnormally colored moles. And then we have D, diameter. We pay attention to moles that are larger than a pencil eraser, which is about 1/4 of an inch. evolving for if a mole has changed, if it's grown larger, but even if it's grown smaller and there's kind of a white area where the mole used to be as it's gotten smaller. That's called regression, and it's kind of a pain for dermatologists because then it's hard to see how deep a mole was or how big it was. And normally the body does that when it recognizes that mole as something dangerous and starts to fight it. So it starts shrinking that dangerous mole. So those are the things we look out for. I can send you all of this information in our portal. So if you're ready to begin the actual mole check, just let me know. Okay, so, alright, just going to use this pencil to draw a circle around any that seem like we should pay attention to. Okay. This one looks good. That one looks good. That one looks good. Let me just check up here. Okay, I'm gonna just look there. I'm gonna mark this one to look closer at with my magnifying glass. I'm just gonna look on your eyelids. Can you close your eyes? Okay, looks good. And then your ears, so we're just looking for any moles or large freckles here. Perfect. And then on this ear, I am going to look through your scalp briefly. Then can you raise your head? I'm just going to look under your jaw. Okay. And you said you haven't noticed any changing moles, right? Or any moles that kind of fit that A, B, C, D, E. Okay. Then your chest. Okay. You don't really have any moles on your arm. Can you spread your fingers? Flip your hands. Good. Other hand. Alright. And any moles on your legs? Okay. Good. Okay, I'm gonna take a closer look at this one under, well, right on your neck, and then that one. Alright, can you look here? Okay, so that one looks good. Now raise your chin again. Okay, I'm just going to rub that pencil off because those look good upon closer inspection. Okay. Now can you stare at me and don't move your eyes? Okay, now this side. Good, okay. Alright, so now we're just going to check your scalp. Okay, so this is just a tool no moles that I saw there. Okay, well that's it for the mole check. I think that I'm going to mark in my notes that we're going to keep an eye on that mole. But I would love for you to do a self-check when you have the time, maybe every month. Just kind of look at your moles, your freckles, see what they're doing. You know, we want to kind of have you, one of our best resources. Pay attention, because that can really help us to know which ones to look at. Alright. So let me just note the quadrant of your face. No, it's not concerning. It's just kind of a size that we want to pay attention to. Alright. Done. Okay. So, again, you'll have the results from the lab sample in less than 72 hours. Then once we get those results, our front desk receptionist will call you and set up an appointment to review next steps. Whether that's antibiotics, an antifungal cream, steroid cream, something of that nature. And we can also see kind of how it's reacted to, how your skin has reacted to taking a break from the tretinoin and using that zinc cream. Okay. The thing with eczema and dermatitis is that it's the long game sometimes, unfortunately. It can last several weeks. So we will check in again. Do you have any more questions for me? Okay, well, I'm so happy you came. Again, your skin looks wonderful, and we're going to get it right on the path to healing. Okay, well, have a good day, and you can just check out